What if I told you that the first 10 minutes after you open your eyes in the morning could be the most dangerous 10 minutes of your entire day? It sounds dramatic, I know. But according to research from one of the most respected neurologists at Harvard Medical School, the way most people over 60 start their morning is silently tripling their risk of having a stroke. And the worst part? Almost no one knows they're doing it. You won't feel it. You won't see it. There's no alarm, no warning bell, just a quiet chain reaction happening inside your blood vessels while you're still in your pajamas, reaching for your slippers, shuffling to the bathroom, putting on the coffee. By the time the symptoms appear, the damage is already done. Stay with me for the next few minutes, because what you're about to learn could quite literally save your life, or the life of someone you love. Hello, and welcome back. If you're new here, this channel is dedicated to helping adults over 60 live longer, stronger, and healthier lives with information you can actually trust and actually use. Today we're talking about something serious, but I promise to keep it simple, clear, and practical. Here's the truth: most doctors don't have time to explain in a 15-minute appointment. Strokes don't usually happen randomly. They follow patterns. And one of the most consistent patterns researchers have found at Harvard, at the Mayo Clinic, at hospitals across the world is that the majority of strokes happen in the morning, specifically between 6 in the morning and 10 in the morning. That's not a coincidence. That's biology. And once you understand what's happening inside your body during those few hours, you can take simple steps starting tomorrow morning to dramatically lower your risk. So let's get into it. Here are the morning habits a Harvard neurologist is warning every senior to stop doing today. The first thing you need to understand is something called the morning blood pressure surge. While you sleep, your blood pressure naturally drops. Your heart rests, your blood vessels relax, and everything slows down. That's good. That's healthy. But the moment you wake up, your body releases a wave of stress hormones, mainly cortisol and adrenaline, to get you up and moving. Your heart rate climbs, your blood pressure shoots up, and your blood actually becomes thicker and stickier than at any other time of the day. Now imagine you're 65, 70, 75 years old. Your arteries are a little stiffer than they used to be. Maybe there's a small bit of plaque on the inside wall. Add a sudden surge of thick blood pushing through narrow vessels first thing in the morning, and you have the perfect storm for a stroke. Here's the part most seniors don't realize. The things you do in those first 10 minutes can either calm this surge down or make it 3 times worse. Let me ask you something. When you wake up in the morning, do you sit up quickly and swing your legs over the side of the bed? Do you stand up right away to get to the bathroom? If you said yes, and most people do, that's habit number 1 we need to fix. When you jump up too quickly, your blood pressure spikes even higher than it already is. Doctors call this orthostatic stress. For a younger person, no problem. For someone over 60, it can be the trigger that pushes an already strained blood vessel past its breaking point. The fix is simple, and it costs nothing. When you wake up, lie still for 1 full minute. Wiggle your toes, move your ankles, take a few slow, deep breaths. Then slowly sit up on the edge of the bed and sit there for another full minute before you stand. That's it. 2 minutes. It can make all the difference. The second morning habit that's tripling stroke risk is something almost everyone is guilty of. Not drinking water first thing in the morning. Think about it. You just spent 6, 7, 8 hours without a single sip of water. Your body has been breathing, sweating a little, working through the night. By the time you wake up, you are in the most dehydrated state you'll be in all day. Dehydrated blood is thick blood. Thick blood moves slowly. Slow, thick blood is exactly what forms clots, and clots are what cause strokes. Now here's where many seniors make a mistake. They wake up and the very first thing they do is reach for coffee. I love coffee too, believe me, but coffee on an empty, dehydrated stomach does 2 harmful things. It raises your blood pressure even higher, and it acts as a mild diuretic, which means it pulls even more water out of your body. So please, before that first cup of coffee, drink a full glass of plain water. Room temperature is best. Cold water can shock the system. If you'd like, add a small pinch of sea salt or a squeeze of lemon. This simple act, a glass of water before anything else, has been shown in studies to lower blood viscosity, calm the morning blood pressure surge, and reduce stroke risk significantly. Many seniors ignore this sign, but if your urine in the morning is dark yellow or has a strong odor, that's your body waving a red flag. You're dehydrated. And dehydration overnight is one of the biggest, most preventable stroke triggers we have. This next one might feel a little awkward to talk about, but it's too important to skip. So I'm going to be honest with you, the way a caring doctor would. Straining on the toilet in the morning is one of the leading triggers of stroke in adults over 60. When you bear down hard, you're doing what's called the Valsalva maneuver. It dramatically spikes your blood pressure, sometimes by 40 or 50 points in a matter of seconds. For someone with stiff arteries or undiagnosed high blood pressure, this sudden pressure spike can rupture a weakened blood vessel in the brain. That's a hemorrhagic stroke, and it happens more often in the morning bathroom than most people realize. If you struggle with constipation, especially in the morning, please don't ignore it. Add more fiber to your evening meal. Eat a kiwi, some prunes, or a bowl of oatmeal. Drink that morning glass of water we just talked about. Move your body gently. Even walking around the kitchen for a few minutes helps stimulate digestion, and if things still aren't moving easily, talk to your doctor. There are gentle, safe options, but please don't force it. Don't sit there and strain. Your brain is not worth that risk. I want to pause here for just a moment. If you're over 60, or if you're watching this for a parent, a spouse, or an elderly loved one, this information could genuinely be life-saving. I'm not exaggerating. Strokes are the number 5 cause of death in the United States and the number 1 cause of long-term disability. But here's the hopeful part. Up to 80% of strokes are preventable. 80%. That means the choices you make in the morning, in the kitchen, on your walks, in your medicine cabinet, they matter more than you know. So if this video is helping you, do me one small favor. Hit that subscribe button and tap the bell. Share this with someone you care about. It might be the message that saves their life. Now, let's keep going, because there are still a few habits left that you absolutely need to know about. Here's one that surprises almost everyone. Your morning shower, specifically a very hot morning shower, could be putting your heart and brain in danger. When hot water hits your skin, your blood vessels dilate quickly. Your blood pressure can drop suddenly, and your heart has to pump harder to keep blood flowing to your brain. Then, when you step out of the shower into a cool bathroom, your blood vessels constrict just as quickly. This rapid back and forth, doctors call it vascular shock, can be very hard on aging arteries. For a senior with high blood pressure or heart disease, this temperature swing can trigger an irregular heartbeat, a dizzy spell, a fall, or in the worst cases, a stroke. The fix is easy. Use warm water, not hot. Aim for a temperature that feels comfortable, not steamy. And before you get out, turn the water cooler for the last 30 seconds. Gradually, not suddenly. This helps your blood vessels adjust slowly instead of all at once. One more tip. Never take a shower immediately after waking up. Give your body at least 30 minutes to settle, hydrate, and ease into the day. Your blood vessels will thank you. Now let's talk about something that affects millions of seniors. Your morning medications. Many people over 60 take blood pressure pills, blood thinners, or cholesterol medications in the morning. And here's where 2 very dangerous mistakes happen. The first mistake is skipping a dose because you forgot, or because you felt fine that day. Blood pressure medication doesn't work that way. It needs consistent levels in your bloodstream. Skipping even one morning dose can cause a rebound spike that overwhelms your system. The second mistake is doubling up. If you forgot yesterday's pill, please don't take 2 today. That can drop your blood pressure too low, cause dizziness, fainting, falls, and yes, even strokes from poor blood flow to the brain. Here's a simple solution. Get a weekly pill organizer, the kind with the days of the week labeled. Fill it every Sunday evening. That way, every morning, you'll know at a glance whether you've taken your medication or not. And one more thing. Please don't take your pills standing up at the kitchen counter with a tiny sip of water. Sit down, drink a full glass of water with them. This helps the pills absorb properly and protects your esophagus too. Many seniors were raised with the saying, "Eat breakfast like a king." And there's wisdom in not skipping breakfast. but the kind of breakfast you eat in your 60s, 70s, and 80s matters tremendously. A heavy breakfast loaded with bacon, sausage, processed meats, white bread, sugary cereals, or pastries does something concerning. It causes a sudden spike in blood sugar, a release of inflammatory compounds, and a rapid increase in something called postprandial lipemia, fancy words for fat floating around in your bloodstream after eating. All of this thickens the blood, raises blood pressure, and adds stress to already stiff arteries, at the exact time of day when your stroke risk is already at its peak. A better breakfast for senior brains and hearts looks like this: a bowl of oatmeal with berries, a couple of eggs with vegetables, plain Greek yogurt with walnuts, or whole grain toast with avocado. Slow digesting, fiber-rich, anti-inflammatory foods. They give you steady energy without spiking your blood pressure or blood sugar. You don't have to be perfect, you don't have to give up everything you love, but please, save the heavy breakfasts for special occasions, not every morning. Now I want to share something that could save your life or someone else's. Before a major stroke, the body often gives quiet warning signs, tiny mini strokes. Doctors call them TIAs, or transient ischemic attacks. They last only a few minutes and disappear. Most seniors brush them off. I'm just tired. I didn't sleep well. It's nothing. Please, don't do that. Here are the early warning signs to watch for, especially in the morning. A sudden weakness or numbness on one side of the face, arm, or leg, even if it goes away quickly. A brief moment of confusion where you can't find a word or you slur your speech without meaning to. A sudden blurry spot in your vision or temporary loss of vision in one eye. A wave of dizziness or loss of balance that you can't explain. A sudden, severe headache. One unlike any headache you've had before. If any of these happen, even for 30 seconds, even if they go away, please don't wait. Call 911. Tell them you think you may have had a TIA. Treatment within the first 3 hours can mean the difference between a full recovery and permanent disability. There's a simple way to remember the major stroke signs. It's called FAST. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Print this out. Put it on your refrigerator. Share it with your spouse, your kids, your grandkids. It's that important. Let's bring it all together. Tomorrow morning, when you open your eyes, remember this. Lie still for a minute before you sit up. Sit on the edge of the bed for another minute before you stand. Drink a full glass of water before your coffee. Don't strain in the bathroom. Take a warm, not hot, shower, and not right away. Take your medications consistently with a full glass of water. Eat a light, balanced breakfast. And learn the warning signs of a stroke so you can act fast. These aren't complicated changes. They don't cost a penny. They don't require a prescription or a gym membership. They just require you to know and to care enough about yourself to follow through. You've worked hard your whole life. You've raised families, you've built careers, you've cared for others. Now it's time to care for you. Your brain, your heart, and the people who love you are counting on it. If this video helped you today, please do 3 things for me. First, hit that like button. It helps this important information reach more seniors who need it. Second, subscribe to the channel and turn on the bell so you never miss a video that could protect your health. Third, share this video with someone you love, a spouse, a sibling, a friend, an adult child who worries about you. Knowledge shared is lives saved. And in the comments below, tell me, which of these morning habits surprised you the most? Have you experienced any of these warning signs? Your story might be exactly what another viewer needs to hear today. Take care of yourself, take care of each other, and I'll see you in the next video.